So that was 2009.
10, yeah.
10.
Yeah.
And then did you have to have any further procedures after that?
So, no, I then had, obviously I was then seriously got the lymphedema because I've sort of got very few lymph nodes now left on that side of my body. They've sort of taken quite a lot of them away, so my leg does swell up quite a lot. So I go back every 9 months to Loros for the checkups on that, which is very comforting because they can keep a quantitative size of my leg, so they know whether it's swelling up or not. Even though whether I feel it might be or not, they can tell me no, it is smaller now or it is bigger. So they can actually refer that back in. So I wherever I can, I try and time those appointments for just before I go in for a further follow-up consultant with my oncologist.
How do they measure that?
So they've got just tape measures.
Yeah, just a tape measure.
So they just measure the circumference.
So you could do it yourself if you were systematic.
Yeah, they're very systematic though, and they do it exactly the same each time, and they know exactly how they're doing it, and then they've got a system that works out the volume of your leg compared to this other one. I did actually have a secondary problem which was nothing to do with the cancer, which was that because I'd had so many operations down here, I ended up with a problem where my bowel had come out through my groin.
A hernia, effectively.
A hernia, but it was a weird one, and I ended up having to have another operation to solve that.
Was it causing a problem with the flow in the bowel, the strangulation?
No. It luckily not, but it was
still quite a serious complication.
It was interesting. And for a while I thought, because it caused a lump, I thought I thought that the cancer had come back.
Yeah, that's understandable.
Whether this is relevant or not, I don't know. So, I forgot to mention that after the reason that the surgery last time I felt was quite minimal was also because at the time, about a month afterwards, I developed a blood clot on my lung, which then had to be treated. And for about 6 weeks, there was a lot of toing and froing between different departments in Royal Infirmary, Glenfield Hospital, as to whether the blood clot was a blood clot or whether it was the cancer having spread to my lungs. And that was exceptionally difficult period of time. We'd got a consultant at Glenfield who was telling me that my cancer had spread to my lungs. And I got a consultant in the Royal who was saying, no, we don't think it has. And they were scanning me quite regularly at that point to try and work out whether the drug treatment that I was having was having an impact. Luckily, it was a blood clot. Which I don't think many people will say that. But luckily it was a blood clot. We treated it with blood thinning drugs, and that got over that side of things.
That's quite a further kind of episode, a complication.
Sorry,
But
so nothing to do with the cancer.
It kind of turned out okay, even though you had to have further treatment for the blood clot. So do you remember what medication they were thinking it might have